Hello, welcome. Good evening to the Quintessencial Tuesday. It's our webinar number 15 today. And I have to excuse Christian Hase. He's sitting in the plane coming back from Spain. But he says many greetings to you all, but I think we can do it alone this time. So today we will talk about orthodontic treatment. And you know, orthodontic treatment in dentistry, you can't forget dentistry without orthodontic treatment. But till past time, it was the case that if you had an orthodontic case, you would send it to a specialist for orthodontic treatment, which takes time. You have to communicate. But today we have so many easy possibilities that we can do some orthodontic treatment in our offices, even as a normal dentist alone. And I'd like to thank Align Technology, who are the sponsors today, because we have one of the best dental speakers in Germany. It's Dr. Mark Sebastian from Munich, and he's one of the key speakers about aligner technique. If you see it from the viewpoint of the dentist, of the normal dentist. And I know that Mark is doing implants, he's doing perio, he's doing aesthetics. And I think in your own office, if you see dentistry in the view of functional treatment, if you see it in the view of aesthetic treatment, you really need orthodontic treatment. And Mark will show us many cases from his office, how easy it can be to solve some cases for yourself with an aligner treatment. And Mark, I'd like to raise my glass for the Quintessencial Tuesday. Welcome here on this evening, and I hope you feel confident. The next 45 minutes are for you. And I have to tell all of you, please use the question tool here. If you have any questions, write them in the chat, and I will answer that with Mark together. And Mark, I'd like to welcome you, and the stage is yours.
Thank you very much. Okay, then let's slip to the lecture. Okay. Okay, perfect. Can you see everything?
It's perfect. Thanks, Mark.
Okay, okay. For that, I'm looking forward. It's cold outside. And ladies and gentlemen, dear colleagues, good evening from Munich. We are looking for snow. Thank you, Chris, for the invitation to speak today about my ideas and my concept of orthodontic treatment for dentists. Today we have caries, tooth decay, and periodontitis under control in our dental office. More and more patients aging with their own teeth, and this never happens before in our generations. What we frequently see in front teeth is a crowning, extrusion, rotation, crooked teeth, and a lot of patients are asking for solutions. In adults, we no longer find any growth in the bone and the skull. On the other hand, and now this is our major problem, we found a shrinking process that occurs with the aging process. So the mandibular is getting narrow, and so the teeth doesn't have enough space for the right position. And this change of the bone in the position of the teeth creates aesthetic and functional problems. And the question is, do we have answers for this aging process of the dentition? So I just want to show you a case I did in 2003. This is one of the reasons why I started with Invisalign. This patient came with a wish for an aesthetic correction of his crowning in the lower front. And the problem was, I published an article in a Munich local journal, and I showed some solution with veneers. So the patient already had in his mind, okay, I want ceramic, I want some quick solution. But as you see, I started to try to find a different solution for him. I started a discussion with him. I tried to convince him to do orthodontic treatment with fixed braces and with brackets. Unfortunately, at this time, his son was under orthodontic treatment. And he was always going with him. And he thought, okay, I will never stay in an office, in an orthodontic office and get my new wires. So he heavily declined to go to the orthodontics. So hard decision to make. I didn't like it, but I wanted to help the patient. So you won't see this really frequently. What we have done, what we had the solution at that time. We had a big gap between the ideal position of the aesthetic and the functional position. So these crooked teeth had to be corrected at that time with really a maximal invasive intervention. Heavily, I had to drill away healthy natural tooth substantium to get some aesthetic and functional results. And this is really like what we always have in dentistry. It's like it's an ethical conflict between sacrificing healthy tooth substance and the wish of the patients and aesthetics. Yeah, this is after 16 years. Patient is still satisfied, but if I now take a look at this result, now the hygiene is very good. He can clean it. We have some discoloration due to the aging of the cement. But it's really like, I don't want to see this. This is for me not an acceptable solution. So at that time I was looking for something new. So this case is the reason why I started aligner treatment in 2005. I visited my first course in Vienna at that time. And the good thing is that we know that the concept of the nature with the aligner is really like easy to treat. But let's take a quick look at this case. I did full reconstruction of the molars and premolars, and the patient was still unsatisfied with the situation of his front teeth. And then he asked for a solution, and we decided to do a tooth movement with aligners. So we totally changed the position of the front teeth. We changed the overjet overbite. We have an aesthetic and functional better result. Hygiene is better, and we did some bleaching. So this is really like an easy change of doing something in a biologic, more natural way. So the good thing is that in dentistry, what I want now to introduce to the aligner system, we are familiar with splints and aligners. We use them frequently for temporary restoration, for bruxism protection, for bleaching. So more or less, we are using splints and aligner in our daily office. So with a series of splints, we are changing, like in the beginning, every 2 weeks, every 10 days, and then every week. We can change the position of the teeth. Every splint change the position for 0.1 to 0.2 millimeters of the tooth in the right direction. So now the question is, what can we as dentists treat safely? And for this question, I stand years ago, and I thought I would start changing just the front teeth. I just want to correct the overjet, the overbite. I just want to keep it simple. Just maybe the premolars, canines, and the front teeth. So, as we know from Kois, who I frequently was listening, the envelope of function is very, very important for the chewing pattern. So if we take a look at this situation and discover the problem and have some simple solution instead of drilling, and just do some small orthodontic treatment, we can really achieve a better dentition for the patient and for the function. By this side, also a better aesthetic. So, as like in Germany, Slavicek is very famous, and I did the master course with him. He shows us that we have to think about the front teeth also in the direction to the joint, that the joint and the front teeth are directly connected, and if the positions of the front teeth are wrong, if we have too much pressure on the front teeth, it has also some effect for the temporal mandible joint. As you see, all front teeth we have to take care of, we have to take a look, we have to see the position of the premolars in the arch bow. And this we really can do easily with an aligner system. So how could we discover this kind of problem? There are two systems I use in my office. We can do a scan by iTero and take a look at the occlusal program. And we found here at the front teeth two heavy contacts in the front. They are marked in red. Or we just can do it like the old system, how I learned it in dental school, and how Slavi showed us that we have too much contact in the front teeth and the molars are really like not in a perfect condition. So we can easily take a look at the occlusion by these two systems we have in the office, and we can detect these kind of problems. So we have a software where we can change our functional and aesthetics problems into a perfect situation. I'm just going to show you the system by the 3D from ClinCheck from Invisalign. And here we have really like a situation where we have too much pressure on the front teeth. And it's just like, it seems to be that one tooth is connected too heavily. We have too hard overjet, and it's like easy to change with just 7 aligners. We really get a better situation. We take off the pressure of the front just by aligner treatment. You see it here in a different view. You see some attachments. Interesting how we widened the front. And now let's talk a little bit how we can do this. Normally the splint, the aligner is just flipping, totally is covering the tooth and is trying to move around the tooth, but an attachment, and this is the conventional attachment, it's a square, and this is really like holds the aligner in position, and a tooth is like really like it's round shaped, and the aligner can't really like take the tooth, and it's like famous for that the 2-2 and the 1-2 in the upper front. They're really like, you can't really like hold it in the aligner if you don't have the attachment. And the conventional attachments are like really like sharp squares, and they hold it that the tooth can be moved. It's like having a suitcase with a grip on it. And Invisalign developed some special attachments for the movement, the individual movement in space. Yeah? So really like for every different movement, you can have a special attachment. So this is like for the movements we can do, the rotations of the tooth. This is now still in the ClinCheck. This is like the virtual world, but I'm going to show you these cases later in real. Here we have a crowning in the front. Now, instead of drilling and putting ceramic and filling up the aesthetic missing parts with resin, we just can do some aligner treatment. Yeah? We really can bring back it in the aesthetic and functional position. We can widen the arch. Yeah? We are now talking, everybody is not talking about airways. For sure, this is an interesting way to change the airways, to give the tongue more space. Yeah, this is like, we can change the canine guidance on also widen the lower. Yeah. We can change the overbite, overjet, yeah. Take out the pressure for the joint. This is really like a special attachment for rotation. It's like every aligner is pushing this attachment forward so that the attachment puts a lot of pressure on the rotation so that the tooth can move. And this is really like a funny system. This is like a cherry stone that's pushed forward. So really we can make an extrusion of the front tooth. Yeah. And we have some power ridge to change the position, to change the torque. These power ridges are placed in the splint on the opposite sides. And there we can really like open without changing the real position, open a little bit the space. We can intrude the teeth with aligner systems to change, really like to get back flat occlusion. And also we can make a single tooth movement. We can really like make a distalization. We can push the tooth in the right position with the whole body. Okay, now let's take another look at the whole system. This is really like in the physiological way how the dentition should be positioned to the joint. And this is a malocclusion where we have too much contact in the front, where the overjet is like reduced, the overbite is reduced, and this is what happens to the joint. It's really like it gets too much pressure on it. Okay, what can we do with changing that? There is the aligner system who can help us to change the front position a little bit. And what can we do with the lower? Do some intrusion. Yeah. Okay. Take a bigger look. We can change this relationship with aligners. And this is really like easy way to help us to get a better dentition, to get a better contact in the molars. Okay, let's jump to some cases. We're really like running in time. This is a patient of mine, older woman, 79 years old. And she was coming and she was asking for some solution. And she was really like afraid of losing his front teeth. She thought her smile is still okay, but there was a big mobility on the front teeth. And she was really afraid of losing it. So let's take a look inside. And you really can see the different size of the centrals. One is like really like shortened. The other is like shows the central on the left side is showing like a little inflammation around the sulcus. It's like it's a little bit reddened. And if you see the open view, you see that the lower front tooth are a little bit extruded. Yeah, the gingival more or less is for this age really like looking perfect. Dentition is very good. Yeah, there's a problem in the function. You see when she's protruding. Let's change. Yeah, she's really like going across the left central. Some plaque, but more or less, this is really not a periodontal problem. Take a look from the other view. You see really like the protrusion of the tooth to one. It's like really, it's totally out of the arch. And if you take a probe, you really will find pockets till to 7 millimeters. And you see inflammation on the palate. The lower is like really like looking from the gum, really like there's really nothing really to talk about. These are the X-rays, and I hope you can see it in the small X-ray. There's also already a change of the bone. There's really like a horizontal defect at the bone visible. These are the models. On the left side, we have a class 1, perfect dentition. On the right side, we have class 2. The front, we have a too high overjet and overbite. We have diastema on the front. These are, again, the models in a different view. As you can see on the right side, that the front teeth from 3.3 to 4.3, they're really like growing out heavily. They have really extruded out of the lower arch. They have a little crowning. These are the contact points we find before treatment. Okay, and this is like really like what I really love to talk about. We have different treatment options. And if I would talk today about implants, we would do maybe an implant at that front. We just would take off the tooth and place immediately an implant, or we can make a bridge and just shape the lowers down so we have no pressure anymore on the front. Or other simple way, we can do some aligner treatment. So this is how we planned the case. How we're planning with the ClinCheck software to bring back the central and to intrude the lower front. And you here see different kinds of attachment. There are some for movements, some are for anchorage. So again, the view in a different, and this was just, I think it was about 14 aligners, and we changed the arch form, the position. We changed the overbite. We pushed down the front teeth. This is, you see the attachment in position, some conventional attachment, some optimized attachments. And this was the end result after the treatment, the Invisalign, the liner treatment. And now really we can see what she was really like missing due to grinding. The 1-1 is really like missing 1 or 2 centimeters, millimeters, sorry. And this is the gap closure. This is the view from the arch, and you see how we control the contact points. This is again with the iTero, I checked the occlusion. I wanted to know how are the contacts now in the front and how to change. Maybe I had some smaller restorations to do. And this is like, then we changed, okay. And she was coming like, I didn't know, a day before her 80th birthday. And she said, okay, now we're really like finished and just change my front teeth that I really, with a little composite filling. Yeah. And she was really like having her birthday with the new solution of the front teeth. As you can see, we really pushed down the lower front. We closed the gap. And this was the smile at her 18th birthday. And she was really like satisfied and happy. And as you could see before, also the periodontal situation was better. If I broke it now, there was no pocket anymore. This pocket was just due to the overload of the front teeth. So let's jump to another case. He wanted to change his smile. He wasn't smiling since he was young. And as you can see, there are some missing small centrals. The canine were used for the closing the gap, and the centrals are really like in a retruded position. The lower front was coming up. As you can see, the arch bow in the front is like really like not in perfect. So and here we wanted to get like really an aesthetic solution. So as you can see, what should we put on in ceramic or resin to get really like an aesthetic solution? And so we talked about changing this tooth position with just some aligners, so that we really like we really get a better outcome situation for doing some orthodontics. We placed the attachments, and again you see some in the front teeth, some extrusion attachments, some rotation attachments, and for the anchorage and the lower, the conventional attachments. And we changed the position of the front teeth. We also widened a little bit the arch form. And here you can see like in a photo the situation after the orthodontic aligner treatment. We changed totally the front tooth position so that we are ready to do some ceramics, some additional work. This was the plan made by DSD, so that we really like get a better outcome of the smile. This is like an easy system to plan whole cases, virtuality. And this is the case. What we have done, he still has the recessions on his canine. but he's very happy with his new smile. And as you can see, how we change the relationship from the front teeth and how we really can minimize the preparation trauma and add some ceramic. Here another interesting case, like we had a crowning at the lower front and in the upper front, and this patient was really like, again, afraid of losing her front teeth. You see like really like the crowning in the front, and how she's the closure of the front and the overbite is like really like far away from really like a functional. Oh, I should take another chin too. Cheers. Oh, that's good in between. Okay, and she's like really like she wasn't unsatisfied about her colors and discoloration, about the crowns, but she was really like afraid of losing her front teeth, and she had a periodontal trauma due to the functional problem. And again, as you can see from the palate view, there's really like redness, infection, there's a deep pocket. We cleaned that pocket before we try to get a best outcome situation from the periodontal view to do our aligner treatment. And we try to change the situation in the front, bring back to better result. Okay, of course it's not perfect, but for the patients we can really like can keep the teeth. As you can see, we totally changed the arch form. She now can clean it really like proper. She's like, the tongue is not irritated anymore. The periodontal trauma, as you can see, is like really totally gone. Now she had healthy gum again, and this is just due to the wrong tooth position, and we can change this easily by aligner treatment. And place some resin in the front teeth there just to change the black triangles. And she's now really like, she's like 75 now and smiling, and she's like happy with this situation, satisfied. Okay, and let's jump to another case, and this is like a patient with heavy TMD problems. We did a splint treatment, and here you can see like she's really like suffering from problems also from the spine, and we are doing this in a whole group in a network with osteopathics, orthodontics, and this where the movements of the joint, and as you can see, like it's like totally different situations of how the joint is moving. And this was just the situation in the mouth. She has a little open bite. The tooth are really like not in the perfect position. As you can see, the midline is a little bit shifted. And she had really like heavy problems with her joint and her neck. And this one problem was really like that the lateral protrusion on both sides were really like totally on the wrong position. Maybe it was also a tongue problem, and the funny thing was we did the aligner treatment and she changed totally the position of her tongue. And these were the contacts, and the lateral protrusion, that we had some wrong balance on the other side, so she couldn't really like shift perfectly to that. And this we made an scan with the splint, the adjusted splint for the joint, and changed the front position. So as you can see, it's like really like also with cases with TMD, we can do some changes. It's like this is the situation before the treatment. This is the situation after treatment. You see really like change totally the overjet and the overbite. Yeah, before, and then we went back to canine guidance. Yeah. As you can see, really like she's now shifting to the side just on the canine. This is before, and you see the tongue in interesting position, and there she's shifting again just on the canine. You see some attachment still in position, and this is like we changed the whole situation for her, and this is the arch form after the treatment. Now let's jump to one of my early cases where I really like, okay, this was like heavy. This was the situation before the treatment, and like I was sitting there at the scan and I was looking at the situation and thought, okay, I had to extract one tooth. I won't get so much space and to put all teeth in the front, and like we really needed for perio reason, for hygiene reason, for aesthetic, for functional reason, a better situation. And the patient decided to do a full mouth reconstruction, and so he wanted also a solution for his front teeth. So we went to aligner treatment, and I did some IPR. I did some cutting off the contact points, losing the contact points a little bit, so that I can achieve this result. And as you can see, the premolars and molars have new ceramic crowns and inlays. So we did at the same time a verticalization. This is like before and after. And as you can see, it's like changing the front teeth in a better position. It's like a perfect result for him to clean again. He was always blaming about the discoloration he had on the tooth behind. So now he's like really like satisfied to have that simple solution just with the aligners. Yeah, before and after, it's like for the hygiene, for the function, and for the aesthetic, it's like I bonded nothing at that time. It's like no touch, just did some slightly reductions on the contact points. Before and after, as you can see, like in the molars, you can see we added some ceramic to raise the vertical dimension. Okay, and here some canine guidance is missing in the lower front. They're really like in the wrong position, and the patient was saying she's looking like a vampire. Yeah, and she wanted to have some solutions, and again, just what we did, changed the arch form a little bit. Maybe we did some good for the airways, placed and in a better function. This is how we change it. We put them back in the arch. We widened the arch, gave the tongues more space. Before and after, uprighted the canine. Before and after. Okay, and then I am really perfectly in time. I want to end with our famous Professor Gutowski, function is not everything, but everything is nothing without function. And I hope to show you how we can do it like simple, easy ways with some rotation, some intrusion, some extrusion, some shaping of the tooth we can do with a liner, a very good aesthetic, functional result, and this will makes our life in the daily clinic easily. Okay, Chris, are you back again?
Yes, Mark, thank you. First thing you have to do, you have to stop your presentation so we can see. Yes, now we can see you. So,
okay, I can't hear you.
this is perfect. You can hear me now? Mark.
Okay. Nee.
So we tried to solve this problem.
Bitte nochmal unten gucken, welcher Lautsprecher ausgewählt ist.
Okay, can you hear me?
No, wait a
Yeah,
second.
we hear you.
I will call him. Give me 1 second.
Yeah.
Okay, give me 2 seconds.
Okay, we can hear you.
Okay, good. You can hear me.
Yeah,
That's the
perfect.
most important thing. So, Mark, thank you very much for your presentation. I think what I really liked in this presentation is these were not just showcases, which you cannot do every day. All these cases are cases made in an office, which you can do every day. There's nothing fancy. There's nothing crazy. There's nothing where you have to work really hard. This is only a thing how you can solve perio problems with easy ways, how you can solve functional problems, how you can solve aesthetic problems. And, you know, when I go back to this lady, the old lady, which was ready for her birthday to smile again, if you send her to an orthodontic colleague, she had to go there. She has to talk to him. And most of them, they say, no, that's nothing for me. Forget that. But if you do this as a normal dentist in your own office, you have so many opportunities to help the people, and you widen your possibilities to do your work. This is absolutely true, and I see so many cases which were only solved by prosthodontic treatment, which is, in my opinion, completely wrong. I think you can never be a good dentist without doing ortho. So I thank you for these cases. Also the perio cases, this is so impressive, and you have so many cases. When you remember, I don't know who was watching us last 2 weeks ago when I made the lecture with Paul Chu. Nearly all of the teeth I lost, which I had to place implants, they were lost because of this crowding in the upper jaw, in the lower jaw. And it's so easily for you to solve this problem with an aligner treatment, because the way you do it is you scan your teeth, you learn about, you have to learn this, of course, and then you make a treatment plan, you get your aligners, and it's easy for the patient. So, Mark, there's one question from Zura Ibrahim. Can we use this type of orthodontic treatment for the patient who has many heavy posterior restorations? This is a little bit tricky.
What means heavy restoration?
I think what she means is when you have restorations in the posterior part, first to say what Mark showed is a system where you move frontal tooth, canines, and premolars, but you can also widen this to up to the molars. But if you have bridges or splintered teeth, of course, you cannot move them. So it's always the question, is it necessary to move the posterior teeth, or is it okay just to move the frontal teeth, the canines, and the premolars?
Yeah,
and how do you solve this in your office?
Yeah, okay. I now have a lot of experience with Invisalign. So I really I feel more or less safe with aligners. And it's like we all have more knowledge as dentists in aligner treatment. When I started, it's like I just was moving the front teeth and the canines and maybe one premolar, and the rest of the cases where I need an orthodontic change, I really transfer them to a specialist. to somebody who's like only doing auto treatment. So it's like, it depends on your experience, what you are really like feeling safe to do the treatment. It's like of course we can move teeth with aligners, but it has to be some really like ethical problem, that you really are sure you can achieve the result the patient is needing. So of course, if you have restoration bridges on the molars, we can change this with aligner. You can't move them, you can't move implants, you can't move bridges, but it's possible to change always the front.
There's another question. How easy or how difficult is it for a normal dentist who's doing overall dentistry to start with these aligner techniques? What do you need? Because everybody thinks now it only makes sense when you have a scanner and that when you work digital.
No.
But I think
Okay.
the entrance to this opportunity is not so hard.
Okay, it's like, Chris, you started in your office like 2-3 years ago, and now it's like every case is now a aligner case in your office. It's like you just have to start to think, what can I do for a single front tooth? How can I change the position? How can I achieve a better result? Just in the from 2-2 to 1-2. Just how can I change? How can I begin with an easy case? It's like the crowning in the front teeth, and this is how I started. Like in 2005, I just changed. It's like from 3 to 3. This was what I was doing, and it was like, and then I really get some experience, and I did 10 cases, I did 20, 50 cases, and then I was thinking, okay, this system works, and I understand how it works, and just start easy. Just take a look at the crowning in the front teeth, and you can do it just with an impression, and send this impression to the lab, however it's called. Maybe it's Invisalign or something else. You can send the impression to Invisalign, they scan it, and then you get the clean check. And the clean check is like just a virtual mock-up situation where you can change the position and make your treatment. First beginning virtually, and then you get the splints and do it in the mouth of the patient.
What do you think? Well, how much experience or how much knowledge in orthodontic treatment do you need to start your first case? So is it ethically okay when you have absolutely no idea about orthodontic treatment, that you just scan a case and you get a treatment option from the brand and you say, okay, let's do it like this? How do you think is the right way for the oral dentist to learn to work with aligners? What do you think? What is the right way to do it? I think you have so much experience, and you know exactly where the mistakes happen.
I think you have more experience because you started like in the last 5 years or 3 years thinking about that. It's like we all know biology. We all studied orthodontic at the university, and if we cut down the cases like in the simple cases and start with that one and have in mind the bone, the tissue, the movements, it's like not so complicated if you don't do too much rotations, if you respect the bone, if you respect the soft tissue. It's not so complicated. It's like but still you have to think and take a book again from the orthodontics, but it's not so complicated to start with the easy cases.
But for example, sorry, go on.
It's you, Chris.
Example for today, we have Invisalign as our sponsor for this webinar, so we just can mention them. How do you tell the people how to start with Invisalign? What do you have to do? Just go to the doctor's side and say,
Oh, okay,
"Let's
okay.
start."
Okay, how to start with Invisalign?
Yeah.
Okay.
How do you learn this?
Okay, there are really like you go on the homepage, and there are some starter courses, and you just book in and start with the first introduction. I think this is now totally online, and there really you get the first knowledge and the first understanding how to do a treatment. This is really like you do it later on the ClinCheck with the 3D, and they have really like some very good Außendienst. Okay. Okay, and you can call them. Yeah, you can call Invisalign. They have really like a hotline. If you don't understand a case, if you need help, it's like, and then we have the master aligner consulting, where also you can book. I think it's like easy to start. Look for an easy case. Maybe it's you yourself or somebody from your staff who has a little crowning in the front. Start this case, take an impression, book a course, a starter course at Invisalign, and start to go with this case to this course and ask for some help.
So just to start, it's not so easy. It's not so hard. So it's you just once have to start. And I know it's our experience in our office, and I've seen it with many colleagues who in our study club who started with Invisalign. If you once started with the aligner technique and do this in your own office, you see how much the benefit is for yourself. This is like amazing, and you see
changing world. Yeah?
And this is the next question for you. It's very interesting when you look into the social media. Aligner technique is exploding.
Okay.
And if you look into Facebook and if you look into Instagram, the people are they're getting message over message from different aligner technique brands. So what is the big difference between aligner and aligner? Because I think there are some systems which are not able to work. This is just making money. But how do you, as a dentist, see what does work and what does not work? For example, do you need attachments or you don't need attachments? How do you choose the right system for yourself?
Okay, it's like okay, there are two things. Let's talk about the attachments. It's like how you want to move this chin class. Yeah? It's better to move if you have something like this on it. It's easy to move it around in space. Yeah? And this is why we need attachments. And it's like Invisalign started, I think they started more or less 20 years in the end of the beginning of this century. They started with the system, and they did now around 10 million, 11 million cases, or we as a dentist did with the Invisalign system. And it's like really like they have all the results and the experience what we did in their cloud, and they know which kind of treatments are really like moving in the right position. So they have the right attachments for the orthodontic treatment. They have a lot of experience. They have a special material. There's like, it's not just a normal splint. It's like a 3-layer splint. So it's fits very well, and it stays very well in the position. So there's a lot of knowledge behind Invisalign. I don't know with the AI or what's coming from the other side. It's very interesting, but I would still trust Invisalign that they have the best knowledge, but they have a very good system. They have very good clinical support. but still, we are as dentists, we have to take care about these cases, and Invisalign is a very good system for me, and I can say for our group and for our study club to work with.
I think this is like an implant dentistry. There are so many implants on the market, and day by day they get more.
Yeah.
And I think in one way, everything works, but you have benefits with the one or the next system. This is you have to find the right system for your office. But there's a good question from Evelina Bonert. She's asking, is there a very good book where you can learn something about aligner treatment? I think Quintessence has
as a Quintessence. I have it at home. It's just I wanted to turn around.
It's a
I want to show it, but
from Quintessence, and I know that it's we saw it the first time at the AAD in Munich, and I looked into it, and I know that my wife is was working with this a lot, and
there's also from Schupp. He has a book about aligner treatment that's very good, and I think she's Canadian, and she wrote a book now with a black cover and an aligner on front, and that's really like excellent.
This is from Quintessence, and I could really recommend
this is from Quintessence. It's like published, I think, in English, like it should be 4 years ago, and I think last year it came out in German.
So I think we were able just to show you a little bit about this world, which is not only for the orthodontists anymore. And I can tell you there's at the moment there's much trouble between the normal dentists and the orthodontists because they see that there are many patients missing in their offices. But by the way, they are using the aligner technique also. So it's not only something for the dentists, but it really enriches your office and it really enriches your work. And I just can recommend to do this and to find a good case to start and to get help by experienced people. And I think this is something you should do, because I think the failure rate is, if you just think about it a little bit and don't make any fancy things, the failure rate is not too big. So Mark, I just want to thank you for this evening. I raise my glass again for you for the Quintessencial Tuesday. I'd like to thank every one of you to watching us again, and I can just recommend in 2 weeks we have Professor Buse, who is introducing his new book, and I think this is going to be a blockbuster again. And this is the 23rd of November. And Fabian, thank you for your help today with the Zoom webinar. And I wish all of you in all of the world a good day and a good night. Thank you very much, Mark. Thank you very much, everybody.
Bye-bye.
Goodbye.